Hi guys, this is David Rilar and welcome to this first video on toxicants that affect the kidneys. Just like we saw for the liver, we have to talk about metals, drugs, certain antibiotics, non-steroidal anti-inflammatory drugs, mycotoxin, plants, rodenticides, and some garage and kitchen poisons. So in this first video, we'll talk about plants and grapes and raisins in dogs. So the first group of plants is actually a large array of ornamental plants in the Araceae family, which do not have any toxicity on the kidney. And if we look at the structures of different oxalate salts, the sodium and potassium salts are soluble, but the calcium oxalate are insoluble, and they look like sharp needles, as we see here. When the animal bites on the plant, these needles get released. They penetrate the mucous membranes of the mouth and create a severe inflammation. So in this slide, we see some examples of the Araceae family that include Philodendron, Caladium, elephant's ear, and dumpcane. And they all produce the same toxic signs that include swelling of the mucous membranes of the pharynx and tongue, severe pain and irritation of the mouth, and the animal may exhibit some head shaking and intense salivation. But apart from that, they are unlikely to show any systemic signs. If the plants are ingested, nonetheless, we may see some GI signs of vomiting, diarrhea, nausea, but this would be more rare to see. So the diagnosis can be made by seeing the swelling of the mouth, maybe some blisters, and the treatment is going to be symptomatic by rinsing the mouth and giving some antihistamines and corticoids for the inflammation. If you wonder, the name dumpcane refers to the poison effect that causes a temporary inability to speak, and in fact it was a way to punish slaves back in the time when slavery was a reality. Now the syndrome produced by plants containing the soluble oxalates is totally different, because they will bind calcium, and when they get absorbed they form calcium oxalate crystals that can cause both hypocalcemia, and they can also precipitate in the kidney tubules, causing kidney damage. So on the next slide we'll see clinical cases for some of the plants that are nephrotoxic, and they could be divided into those containing soluble oxalates and those that have other types of poisons. So we're going to say something about Carly dog, halogeton and greasewood, rhubarb for those with oxalates, and for the other ones we'll talk about pigweed, Easter lilies, and oaks. And the first one is Carly dog. This is in the buckwheat family. There are several dozen species. This is one of the most common wheats across the U.S. that you might find in pasture lands. The leaves are mostly basal, with flowers that are small and dense in a spike-like terminal cluster. The plants turn from green to reddish brown when they mature, and they have individual seeds that are enclosed in a papery wing structure that helps them carry with the wind. Now, a clinical case in this slide, we have a group of 100 mature Suffolk ewes that were introduced into a 1 acre lot for 40 hours, at which time 2 ewes were found dead and 8 were sick. And the signs were depression, profuse salivation, tremors of the head and neck, ataxia, and recumbency. The 2 deaths had acute tubular necrosis with intertubular birefringent crystals that were arranged in rosettes, and when they did special stains, they confirmed that these were made of calcium oxalate. Other lesions they mentioned were dilation of the renal tubules and flat and degenerate tubular epithelium, and they also found large amounts of broadleaf plant material that was consistent with Carly dog in the rumen contents. Now the 8 sick ewes were taken to a teaching hospital, and the laboratory results of blood prior to treatment showed an elevation of BUN, creatinine, and hypocalcemia. They were treated orally with magnesium hydroxide, activated charcoal. They gave balanced electrolyte solutions by a stomach tube, along with some calcium gluconate parenterally. 6 of the 8 ewes responded favorably and were returned to the farm 8 days after the admission to the hospital. And they took samples of the Carly dog in the lot, and the concentrations of oxalic acid was between 6.6 and 11.1% on a dry weight basis. Now, how much is this in terms of being a toxic dose? Well, there is no specific number or dose that we can tell is toxic because, like it happens with nitrates, the ruminal microflora will readily metabolize the ingested oxalic acid, and if those microbial populations increase with gradual exposure, they make the animal a lot more tolerant to greater quantities of the toxic plant material. Another plant which is high in oxalic acid is rhubarb. The stalks are edible, and as you know, they are cooked for food, but the triangular leaves are toxic, and obviously they are not edible. This is one of the most dangerous plants in our garden, and in fact humans have been poisoned after ingesting leaves. Apparently that took the lives of many people during World War I. And if you were to ingest them, the oxalic acid needs to be removed by treatment with chalk or what is the same, calcium carbonate. Otherwise, that oxalic acid is very irritating and can cause severe abdominal pain and cramps, apart from the hypocalcemia and the renal damage that follows. Now, here is an interesting study showing that in a matter of 4 to 5 days, ruminants adapt to diets containing increased concentrations of oxalates. This increased rate of oxalate degradation drops very rapidly when the intake is stopped. And as you can see, the title is Changes in Ruminal Oxalate Degradation Rates Associated with Adaptation to Oxalate Ingestion. So the objective was to determine the rates of oxalate degradation in ruminal contents of adapted ruminants. And what they did is they selected halogeton, which is a desert plant with very high concentrations of oxalic acid, in this case 12% of its wet weight. And they made pellets with 30% halogeton and other types of feed. And during day 1 and 2, the sheep were given 1.3 kilograms of halogeton and alfalfa pellets in a 1-to-2 ratio. On day 3 and 4, the ratio changed to 2-to-1 in favor of the halogeton pellets. And on day 5 and longer, they were given just the halogeton pellets containing 30% of halogeton. So the results are shown on this figure here. Each line on the figure is a different sheep, and what it shows is that in just 3 to 4 days, there is a 10-fold increase in the in vitro rate of oxalate degradation by ruminal microbes. To give you an idea how much that is, adapted animals tolerate 8 times lethal doses than unadapted animals, which is about 1 gram per kilogram of body weight. What I found interesting in this paper is that certain antibiotics inhibited the degradation by microbes, and the other take-home message is that the protective mechanism drops suddenly when the ingestion of halogeton was stopped. Now, if we look at the website of the Poisonous Plant Research Lab at the USDA, they say that most losses take place when hungry animals are allowed to graze in heavy stands of halogeton or greasewood. At 1 gram per kilogram of body weight of oxalate can be lethal, and their recommendation is not to introduce livestock into areas that are heavily infested with either plant. This cannot be done unless, and I emphasize unless, it can be done slowly to allow time for the adaptation of those rumen microbial organisms. Also, another recommendation is that we should not allow the animals to eat large amounts in a short period of time. In order to prevent this, we can provide some supplemental feeding before grazing in infested areas. Now, moving on to another plant whose toxin is not oxalic acid, and for which there is also many cases reported worldwide, is pigweed. There are also dozens of species. Probably the best known is the one shown here, Amaranthus retroflexus. It is called pigweed because apparently pigs like it. And in pigs, the classical lesion is perirenal edema, and therefore the condition is called perirenal edema syndrome. The plant is extremely easy to identify if we look at the leaves and the flowers. The leaves are alternate with long leaf stalks. They have an ovate shape, and the flowers take place in a very dense, thick spikes, as we see here. There are three toxins. Two of them are oxalates and nitrates, but what is the classical perirenal syndrome must be produced by a toxin which is still unknown to this day. The nitrates would be more of a problem if it is from hay that has been contaminated with pigweed, and when it dries, the nitrates concentrate in the plant. On the slide, we see what the classical lesion looks like. There is a retroperitoneal edema in the perirenal connective tissue, and as we will see on the next case, edema is also present in the ventral abdominal wall and the perirectal area. On histopath, there is total necrosis of the convoluted tubules with a lot of proteinaceous content inside. This is actually called a coagulative necrosis, and this is somewhat different from other nephrotoxins that we just saw, like the oxalate containing plants. As I said, there are numerous cases reported in the literature. I like this one from South Africa that describes an outbreak of perirenal edema syndrome in cattle associated with the ingestion of pigweed. So the history is that they introduced 150 calves into an old field corn with heavy stands of amaranthus, and after 8 days they noticed many animals sick, and 8 of them were dead. This is actually typical for most cases reported. About 1 week of consumption before the onset of clinical signs that may last up to another week, and they usually all end up in dying. As a matter of fact, they lost 47 of the 150 animals in this case. Now, they did not make a very good description of the clinical signs. They just said there was sudden onset of ataxia, knuckling of the pastern joints, and recumbency. And probably the most conspicuous signs were the subcutaneous ventral edema that we see on these photos in the ventral abdominal wall, and also perirectally associated with vaginal prolapse. Now, when they opened the animals, they found a lot of mesenteric edema and perirenal edema, which is pointed with the arrows, as well as a lot of peritoneal fluid. The renal histopath showed the widespread nephrosis with coagulative necrosis of the tubules. There were no oxalate crystals or interstitial fibrosis that can be seen with other types of nephrotoxins. We said that some cases of pigweed can be attributed to nitrate poisoning, but in this case we can say that there was no chance of that being involved, because nitrate kills the animals in a matter of a few hours and not more than a week past the ingestion. So in this case, it took almost a week for the animals eating every day on the pigweed. And if we talk about oxalates, they did not really have any role, because they didn't see any of the crystals in those renal tubules. Now, the tubular obstruction is what causes the urine to back up, resulting in leakage into the perirenal connective tissue. That explains the edema, which, as we said, is a hallmark of the gross pathological features. If they had taken blood samples, they would have probably found marked elevations of BUN, creatinine, and potassium. Now, let's discuss oak poisoning, which has many similarities with pigweed in what is the presentation in animals as well as the pathology. The toxic principles are a combination of tannins and gallic acid, and as we can see in the image, tannins are a polymer of phenolic compounds that form strong complexes with proteins. And if you notice, there is a glucose molecule at the core of the structure, and there are many gallic acid groups binding to it. Now, gallic acid can be used as a diagnostic marker in the urine, but you would need to compare it with values in healthy animals. So probably a better diagnostic measure would be finding, for example, acorn husks in the feces. Now, most cases take place in the springtime when the leaves and the buds are young and tender, and obviously when there are a lot of acorns on the ground, which tends to happen during the fall. They will need to ingest very, very large quantities of leaves or acorns for at least 2 to 4 weeks before they become sick, which we just saw is longer than required for pigweed. That was about 1 week. Once they start showing signs, they usually die in a few days, just like with pigweed. And the two target organs are the GI tract and the kidneys. They start showing GI signs with anorexia, colic, constipation, hard feces covered with mucus. And in 2 to 3 days, that turns into a bloody diarrhea. They have polyuria at first and extreme thirst. And all of these signs are followed with other ones of kidney failure that include azotemia, low specific gravity, glucosuria, proteinuria, dark-looking urine, subcutaneous edema, and they will die with complete anuria. So let's describe a clinical case from the UK that was published in 2015 on the Equine Veterinary Journal. The criteria for diagnosis was a history of exposure, the clinical and laboratory data supporting GI and renal disease, and the presence of acorn husks in the feces or the GI tract of a dead animal. 9 horses were admitted within 12 hours of the onset of signs. That included depression, inappetence, hemorrhagic diarrhea, colic. They were given IV fluids and plasma to counteract the hypovolemia, also flunixin meglobin for pain, and antimicrobial therapy for the hemorrhagic diarrhea. Of the 9 horses, 6 rapidly deteriorated and were subjected to euthanasia, and 3 of them survived with medical management. The post-mortem findings showed severe mesenteric edema, like we saw with pigweed. You can notice that gelatinous appearance of the serosal surface. There was also a necrohemorrhagic and ulcerative typhocolitis and enteritis, and obviously the hallmark lesions is acute tubular necrosis, which is not shown here on this slide. On this paper, out of Belgium, they described 7 cattle also submitted to the University Hospital for suspected acorn poisoning. These cattle had been grazing on meadows with oak trees for 3 weeks up to more than a month before the onset of signs. And the clinical signs at their presentation were of lethargy, anorexia, ruminal stasis that goes on with constipation. And the complementary examinations included some blood work, and we see some of the results here on this table. BUN and creatinine were very elevated, and there was also an acidosis shown by low pH and low bicarbonate levels. So it's obvious there is severe uremia and that the kidneys are failing. They did some urinalysis and found glycosuria, proteinuria, and low specific gravity. 5 of the 7 animals deteriorated and had to be euthanized. One sign that indicated poor prognosis was developing that ventral edema, which is shown here in 2 of the animals. Actually, the 2 animals out of the 7 that responded to the treatment, the renal parameters returned to normal in the following days. And a follow-up 6 months later showed that those 2 animals were perfectly happy. So, what were the necropsy findings on those 5 animals? In the GI tract, there wasn't much of anything. They report some ulcers in the abomasum and small hemorrhagic foci in the small intestines, but nothing like what we saw for horses. Another lesions were the hemorrhagic areas at the junction of the medulla and the pelvis. That is what the yellow arrows are pointing in this kidney. And on microscopic examination, there were multifocal tubular necrosis, with granular cylinders. That's on the black arrow is showing that lesion, and a healthy tubule is shown with the blue arrow. So you can tell that the tubular epithelium is no longer visible at all, and the lumens are completely obstructed by that necrotic material. Now, the last toxic that we're going to discuss is ingestion of grapes and raisins. After 20 years since it was known that grapes and raisins can be poisonous to dogs, they have just found out that it is tartaric acid, also found in tamarinds and cream of tartar, that is actually the toxic principle. As you can see here, it's an organic acid that occurs in many fruits, particularly grapes. And the problem is that the concentration of tartaric acid in grapes can vary a lot, from 0.3% all the way up to 2%, which makes predicting toxicity very difficult. So the problem that we see is that some dogs may eat large numbers of grapes and experience no problems whatsoever, and there will be others that eat just a few grapes and experience severe toxicosis. So when you encounter any case, you want to always err on the side of caution, which means decontaminating the animal, ideally hospitalizing for 1 up to 2 days with IV fluids to protect those kidneys, and obviously do a complete blood count and serum chemistry to make sure that those kidney parameters are not going up. If you allow for the oliguria or anuria to set in, the prognosis will be poor. This is a retrospective study of 43 dogs from records of the ASPCA database, of animals that develop signs of kidney failure, and it's a pretty good one to see what signs would be expected by the ingestion of grapes and raisins. Vomiting was reported in all dogs, 100%. This was followed by lethargy, 77%, anorexia, 72%, diarrhea, 51%. And all of these signs mentioned up to here develop within the first 24 hours. And after that, other signs that would follow would be abdominal pain in 28%, ataxia in 23%, and weakness in 19%. And if these last 3 signs were manifested, they were associated with a very negative outcome. And this is what is shown on the column with the percent of dogs exhibiting each sign that survived. As we can see, if there was oliguria and anuria, only 24 survived, just 10% of those with ataxia, and 12.5% for those with weakness. So the outcome was that 23 of the 43 dogs survived with the treatment, and those dying did so around day 6 after the exposure. Now, if we look at some of the clinical path results after 2 days of exposure, BUN, creatinine, calcium, phosphorus, and particularly the calcium phosphorus ratio were very elevated, and in all the animals in which blood work was conducted. The higher the calcium phosphorus ratio, the worse the prognosis they had. When that ratio exceeds 60 for both elements, they tend to precipitate and mineralize soft tissues. So as we can see on this table, the ratio was almost twice that value for most dogs. We have a value of 139 at 2.5 days and 151 at 3 days. Now, the most consistent lesion in post-mortem examinations was the diffuse renal tubular degeneration with proteinaceous and cellular debris occupying the lumens. In a few dogs, there was mineralization of extrarenal tissues like the gastric mucosa, the myocardium, and the blood vessel walls. And this lesion that we see here is actually quite similar to the one we just saw for pigweed and acorn poisoning, which is a coagulative necrosis. So as you can see, different toxins can produce similar lesions. So let's summarize a little bit what we just said. The diagnosis is done by a history of exposure, or the owner may just tell you that the dog vomited a large amount of grapes and raisins. Keep in mind that vomit may happen many hours after the exposure because they sit on the stomach, and there is a very long delay of the stomach empty, up to 6 to 8 hours after the ingestion. In any case, vomit has been reported in just about every dog exposed, and it is the most common sign of all of them. Now, the other thing would be to bring the dog into the clinic and do some basic renal panels that should include BUN, creatinine, calcium, and phosphorus. And if these are elevated, what will follow is oliguria and anuria. So you want to start fluid therapy immediately. Ideally, you want to monitor the urine output to see if there is already oliguria starting. Remember that BUN and creatinine may not start to get elevated until 24 hours of the exposure. And if you monitor urine specific gravity and it is low, that's also an indication that the kidney is starting to fail. The treatment includes aggressive decontamination. If the dog has not vomited and there is a history of exposure, you want to induce emesis and follow it with activated charcoal and a cathartic. You can suggest the owner to hospitalize the animal for a couple of days and initiate IV fluids to protect those kidneys. And if the animal is showing any GI signs, you may want to support that. I have listed here antiemetics, phosphate binders, proton inhibitors, if there is azotemia, and also if there is azotemia, you can go with not only omeprazole but also sucralfate. Now, if the animal develops oliguria or anuria, you may need to dopamine and or furosemide on top of the IV fluids. And if that's not useful, the final option is obviously peritoneal dialysis or hemodialysis. Now, to end the presentation, I wanted to highlight that because one substance is not toxic to in most animal species, there are always going to be exceptions to the rule, and I wanted to highlight some here. For example, amitraz is very safe in every animal species except for horses. The same applies to fipronil and rabbits. You can kill them with therapeutic doses in any other animal species. The dogs are very sensitive to doses that would be safe also in other species. And these are tartaric acid, which is what's in grapes and raisins, bifenthrin granules, xylitol that we will discuss, that we discuss in the liver section, and obviously for colic breeds, you always want to keep in mind ivermectin. And finally, in cats, we always have to keep in mind lilies that we will see on the next video. So this is the last slide. I'll look forward to have you on the next one. So take care, guys, and bye-bye for now.